Today we want to introduce you to the new innovative headrest, the FlexiPose, or as we call it, the Flexi for short. To begin this demonstration, we want you to get an understanding of the look of the Flexi. The Flexi has a middle section or a frustum that can be raised, lowered, or shaped or molded, customizing it to the patient and the procedure. There are lateral reservoirs for keeping the beans or fill when they are not pushed to the middle to raise the frustum up and down or to mold to the patient. There's a valve located on the back side used to inject and withdraw air using the suction tubing from a standard suction setup. The other thing we can do, is hook the hose up to the oxygen to inject air into the bag so that the beans flow a little bit easier. Here I've used a 5.5 pediatric uncuffed tube, which I've cut to use as an adapter. But you can also use a 5-in-1 connector, which you can find in any operating room, and it works just as well. The headrest, it's about the same size as a regular bed pillow, as you can see here. The FlexiPose is made of a waterbed film. It's about 0.44 millimeters thick. It's extremely durable, and it has a filler made of plastic beads and styrofoam that can be molded very easily. Now here you can see the middle and the lateral reservoirs with filler that can easily be moved and molded and injected into the middle, raising and lowering the frustum. As the beans are pushed inward to achieve height, the vector pushes the beans upward, which raises the patient's head and puts them in the position that you want them in. The bottom of the board is a hard plastic. Its width is the same as the OR table, as you can see here. That gives it maximal stability. It does not rock. The valve is a standard beanbag one-way valve, which you will pinch either to inject air or to pull air out. Air can be injected in or pulled out of the valve depending on how solid you want the device to be. If you apply maximum suction to the device, it becomes rock hard. And of course you can pinch the valve and pull back and entrain some air, and then the bag softens up and it's very moldable. Here's the old headrest, one I'm sure you're very familiar with. The problem? It's one size fits all. And our patients, they come in all shapes and sizes. And it's been our only choice up until now. It does a poor job of putting the patients in the correct anatomical position, as you can see here as the patient lays in the headrest. His chin is tucked into his chest and his ears are well below the sternum. Poor position. Now, whether you accept the 3-axis alignment or the 2-curve theory, this position is poor. We take an easy airway and we make it difficult. And what do? We maneuver the head up to try to put him in the sniffing position. And we reach around the front and we push down the larynx, trying to get it to drop into view. Look at the difference in height. And now look at the comparison as the patient settles into each device. The difference in positioning is obvious. Here I want the patient's head at the top of the Flexi so his shoulders fall on the lower half of the pillow to compress it and form a ramp. If I press the lateral sides together, his head will rise even greater in a difficult airway scenario. But here I feel comfortable intubating the patient in this position. When I push the back of the Flexi like this, I get a sniffing the morning breeze position and a great view of the larynx. The Flexi is hard here, but if I entrain some air back into the device, it softens and it still maintains its position. When the patient leaves the Flexi, we can see here there's a ramp, and we can see where there's a head compression molded perfectly in the Flexi. It's absolutely molded to the patient. And every patient is different, and it will be molded to each individual patient. Because the Flexi is a bean bag, the perfect position is obtained every time with every patient, independent of the person's size and shape, and it can be changed at any point during the procedure. Let's say you're going to the lateral position. The patient's head and neck are supported and molded if you will, by the Flex C. At this point, the lateral aspects of the Flex C are pushed inward to mold even more to the patient and create a very, very stable position. The air can then be evacuated to solidify the position. We have perfect neck alignment, exactly what we're looking for. For pediatric patients, I want to obtain the optimal position as well. I can mold the Flex C to a lower height with ramp up, sniff position very easily. Because kids don't weigh a lot and don't understand the concept of wiggling down into the beanbag to get it to mold to them, I usually go ahead and shape it. The lateral reservoirs then stretch out to become little arm tables for the little patients to rest their arms on. Here you can see it is rigid, so I usually put a towel across for padding. And I mold it a little more to make sure it's comfortable for the child. Now is a good time to introduce our universal headrest, the OmniRest. It's made for all patients in all positions. It has a neck cutout and is soft, so it can actually mold to the patient's head. It has a cutout for the pediatric prone position and is scored for tearing out the adult prone face opening. Because we are using the Flex C to achieve the desired height rather than 9 inches of foam as seen here in the size difference, our headrest is about half the cost of the standard prone headrest. Plus we're using the Flex C, the height and the position of the prone pillow is exactly customized to the patient and it is very, very stable. One other note, with the OmniRest being half the size of the standard prone headrest, we are sending less than half the waste to the landfill. One little change by each of us can really add up. In the prone position, we use a special platform that rests on the Flex C. You can see there's an underside radius that fits down into the Flex C where the tubes come out, and there's a cutout for the face. The platform is pressed down into the Flex C, and the tubes come out the bottom in either direction. You can rotate the platform and create different pressure points on the face. In this demonstration, I attempt to demonstrate a flip to prone without a patient. Now you get the idea, it's much easier with the patient, as I wouldn't have to hold everything. My point here is that the tube is easily guided from the platform and then it's viewed easily for troubleshooting, such as kinking or secretions in the tube or what have you. Now here's the patient in the prone position. Now I tweaked the Flex C a little bit and now his C-spine alignment is perfect. To change the pressure point on his face, pull the platform in and that puts pressure here on his forehead. Or you can roll it out and that moves the pressure to the chin. And then you can roll back to midline for face down pressure. This concludes the demonstration of the new innovative FlexiPose. Thanks for watching. Please visit the Flex C product page to get additional information and the link to purchase the Flex C.